Howdy folks, High Value DMD. This video I'm going to talk about this topic. Dentistry is medicine, and I'm going to prove it. Many people view dentists as fake doctors, not real doctors. In movies, in TV shows, that's a common joke people make. And people just tend to have sort of a dissociation between the mouth and the rest of the body. Well, I'm going to talk a little bit about dentistry and how it actually is very medically related. So if you don't know about dental school actually is the same, more or less, as medical school for the first 2 years of the education. I've taken classes such as anatomy and physiology. I've taken biochemistry and pharmacology, studying medications and their interactions, how they work in the body, all of that stuff, the same as a medical student would. And so I have essentially learned a lot of medicine like that. I've learned pathology, stuff about, cancers and renal cancers, GI cancers, brain cancers, and all that. And especially since I've taken the exam for oral and maxillofacial surgery, which is essentially the USMLE Step 1 exam. It's a medical school exam. I have definitely taken medical school exams. So dentists really do have a lot of capability and a lot of education in the field of medicine. We take blood pressure at our visits with our patients. We have to understand diastole, systole, basic stuff like that. What is blood pressure? What is hypertension? What medications bring down that hypertension into a normal range? What is a normal range? Pre-hypertension, hypertension stage 1, stage 2, stage 3, all of those things that we learn. So that right there, that should be, kind of proof to you how I'm talking, that we're not completely oblivious to these things. Diabetes, the metabolism behind diabetes, what's the mechanism of action of insulin, of glucagon, where do those things come from? They come from the pancreas and the fed state and the fasting state, etc., etc. Biochemistry for you. And a very interesting thing I want to talk about with dentistry is that it is medicine, because there are fields of dentistry that are quite literally medically oriented. Number one, oral and maxillofacial surgery. That is a surgical specialty that is quite a hybrid between medical and dental. Oral and maxillofacial surgery, how would I explain it? So you do 4 years or 6 years. The programs mainly pertain to surgeries such as jaw surgery, to put your jaw in the correct place, or plastic surgery, aesthetic surgery like rhinoplasties of the nose, otoplasties of the ears. You have, like lip, what would you call them? Lip bumps, like Botox, stuff like that. You do those procedures in oral maxillofacial surgery. You take trauma. You do wisdom teeth, of course. You learn anesthesia. You learn how to do a general anesthesia on patients and bring them out of that anesthetic state. All of those things. So I'm sorry, I'm pausing, folks. Somebody was walking by. Anyway, so oral and maxillofacial surgery, very, very medically oriented. Also, dental anesthesiology is another field that people don't quite know all that about. So dental anesthesiology started in the Vietnam War. There was a lot of physicians that went off to war, and so there was a shortage of people that could offer anesthesia services. And if I remember correctly, the father of modern anesthesiology was actually a dentist. During the Vietnam War, there was a lot of dentists that were trained in anesthesia to deliver general anesthesia. So that's how we had a dental anesthesiology residency. And that type of residency, those people, they learn deep physiology and pharmacology interactions, and they're in operating rooms and they put patients to sleep. They intubate patients, and oral surgeons, they do that in their residency too, but dental anesthesiologists even do more in depth, so to speak, of that field. That's all they do. So, and they also take the CBSE, which is essentially like the USMLE Step 1. So that's a field. What's another field of dentistry? You have oral facial pain. Orofacial pain is essentially dealing with neurology, but it is a dentist who's an orofacial pain specialist. Deals with pain deriving from the temporal mandibular joint or nerve pain, and diagnosing that and managing that with different medications and different exercises. There's fields such as oral medicine, dental sleep medicine. That's not really a recognized dental residency, but it's a thing, like dealing with sleep apnea and the airway. And so you get the point. Like, I'm going on and on about all these fields, and maybe I should make videos pertaining to each separate one of these and what I know and my experiences with it. So anyway, if you have any questions about dentistry and medicine and how they're intertwined, please let me know. Please let me earn your subscription. Don't just give it to me, but let me earn it. And as always, stay hustling.